there's years of kind of tension and fighting. In your experience, how difficult is it to turn things around when you've already, gone down that road?
It's it's actually really easy, and it's kind of, I'm going to be a little repetitious, and I'm sorry for that. What is a pivot point for us in our relationships with our loved ones, and if you're a professional also doing this with your clients, is to understand what was hurtful, what is making your loved one angry or even fearful or even paranoid about you. And it is almost always the history of your telling them they're sick and they need help. So apologize for that and promise never to do it again. You don't ever have to do it again. If it hasn't worked in the past and you keep doing it, Einstein's definition of insanity, it's insane. You're not going to get a different result. So give it up. It's a tremendous gift to give to your loved one. I'm not going to tell you you're sick. I am not going to tell you you're mentally ill. That opens up the door to a completely different relationship and way of communicating that the research shows and my experience shows leads to the person accepting your advice to try treatment. So apologize and promise.
One of the statistics that jumped out at me too is that, even if you're following this approach and you have this good relationship, still only 25% of patients take their medication as prescribed. Is that a correct?
No, that's baseline what we see. About 25 to 30% take medication as prescribed. When you use a LEAP approach, those numbers go up significantly. We have an outcome study we're doing right now, and we had another study that was done with inpatients, and we're finding rates of 70, even 80% will accept treatment and stay in treatment. So it's all about how you approach the person.
Wow, that's huge.
Huge shift.